Hi, Dr. Pelto here. I'm going to talk a little bit today about a question that I got from a patient on YouTube. If you have your own question, please put it underneath this video. I had surgery about 8 months ago, and it was fine initially, but noticed a small sliced of nail growing up in the corner and throbbing pain. Did my surgeon mess up? What you're explaining when we're talking about ingrown toenails, this little slice of nail right here, this is called a nail spicule. And the procedure that most likely you had, it's hard to tell exactly from this question, is a chemical matrixectomy. And what happens, this is a treatment that's done for an ingrown toenail. You can see here, there is an ingrown toenail example here, and even an ingrown toenail example here. When someone has a chronic ingrown toenail, that means it grows into the edge, and then the first time you see a doctor, we trim down this line, we take out the nail, and then in about 3 to 6 months, the nail is going to grow back. If that happens multiple times, we do something called a permanent matrixectomy. That's where we take out the edge and we put a chemical here at the base of the nail. This chemical is usually sodium hydroxide or phenol, and this stops the nail from growing back. Occasionally, the nail can grow back, and this is what you see in this picture. This picture is an example of a spicule, or a piece of nail that grew back. This normally happens when you try to kill the root and you can't do it. It can also happen, though, if you remove a portion of the nail and the nail grows back, but it has a permanent cut at the base of the nail. So the base of the nail underneath the skin right here is called the matrix, and this is where it grows from. Therefore, if you cut the nail with a razor blade back here and it injures the matrix, the nail may always grow out in this linear shape with this crack in the nail. What can you do? This isn't really a mess up. This is a common complication. When you're doing a matrixectomy, there are two main common problems that can happen. One is you can get an infection at the nail base, which usually isn't an infection, but patients think it is. And the second problem is you can get a nail spicule. The spicule usually happens at about 8 months, like you mentioned here, and the nail grows back. To do that, to do the treatment, you retreat it. So you numb the nail up and you take out a portion of this nail again, and you apply the medication on the area again to retreat it if it bothers you. Other patients that don't want to go through the bother of having that problem, we just trim the nail, and they can trim it every few months on their own if it's problematic. But many times patients want the treatment because this little spicule thing here is going to snag on your sock or on your shoe, and it just kind of feels funny. So that is some information here about this. If you want to learn more about ingrown toenails, I'm going to include a couple of other videos here about ingrown toenails, or about this course that I have on ingrown toenails, so you can learn more. Once again, if you haven't subscribed, I'd love it if you would subscribe to this channel, and please put any other questions that you have so I can answer them at a different time.